Hi guys, Dr. Joel here today with Wayland Chiropractic and Rehabilitation. Today we're going over an at-home activity for shin splints. So in this video I'll be showing how to do a basic manual therapy technique to start working out your tibialis anterior and your tibialis posterior, two common muscle groups that will go into a spastic state or start to develop trigger points with overuse. Typically comes about with running, but it can come about with other activities that are involving kind of repetitive ankle loading, lower leg loading. So in this, I'm showing the basic contact here where I'm coming just off my knee onto the tibialis anterior. I'm using a two-finger contact. I'm going to start here with my toes raised. I'll apply some pressure down with my two fingers, sandwiching that muscle between my thumb and those two fingers, and then I'll very slowly let my toes come back down to the ground, and then I'll lift my heel up into a heel up position there. I'll hold that for just a second. I'll release the pressure with my hand, and then I'll return the foot to that toe up position, and then reapply, working that same movement all the way down the leg here. And I'll go until I get just above the ankle, kind of right where I start to feel that muscle no longer be palpable and easy to get at. At that point, I'm going to start working the tibialis posterior. Here I'll be reversing the movement, but still sandwiching that muscle with my hand. When working this muscle, I prefer to use my thumb and then wrap my fingers around the front of my shin, like so. And with this, we'll start with the heel up. We'll apply the pressure with the thumb, and then very slowly let the heel return to the floor, and then end by lifting the toes off the floor. We'll hold it for a second and then continue working that same movement further down the leg until we get just above the ankle. Here I'm showing a similar way to work the tibialis anterior. This way I'm dangling the leg and allows for a little bit easier movement, especially if you have any sort of knee complaints or knee troubles getting with that initial position. And then in just a moment here you'll see I've reversed that and simply do that same movement for the tibialis posterior. But again, I'm letting the leg dangle. This is allowing me to get more motion out of the joint. Give this technique a try. Leave me a comment if you're under any sort of difficulties, and I will catch you guys on the next one.